Assalamu alaikum everyone. I hope all of you are doing well. In this video, I'm going to talk about the rotator cuff. So first, I'm going to define the rotator cuff. The rotator cuff are a group of muscle in their tendon that attach to the scapula and converge on a humerus that stabilize the shoulder joint and allow extensive range of movement for the shoulder joint. So this is the definition of the rotator cuff, and there are two functions that reveal from the definition. One is stability, the other is extensive range of movement. So going to the rotator cuff, we have four muscles in their tendon in our scapula that contribute to the formation of the rotator cuff. The muscle arise from the scapula and these are converged on the humerus. It then form a cup-like structure which is called a rotator cuff. Four muscle making the rotator cuff. The first is the supraspinatus muscle. You can see over here, this is the supraspinatus muscle and this is the infraspinatus muscle. These two arise from the dorsal surface of the scapula, and the other is the subscapularis muscle. This is the subscapularis muscle, and you can see it and there is another muscle which you can see from the inferior. You can see over here, this is the teres minor muscle. So these four muscles making the rotator cuff. The first is the supraspinatus, the second is the infraspinatus, the third is the subscapularis, while the fourth is teres minor muscle. These four making the rotator cuff. So as you all know that the shoulder joint is formed by the head of the humerus and the glenoid cavity of the scapula. So there are two tubercles near to the head of the humerus. The first is the greater tubercle. The first is the greater tubercle, while the second is the lesser tubercle. This is the lesser tubercle. While the greater tubercle is further divided into three facets. One is the superior facet. This is the superior facet. This is the middle facet, while this is the inferior facet. So these facets are important in insertion of muscles. So now going to the attachment of the muscle, as you can see over here, the supraspinatus arises from the medial two-third of the supraspinous fossa, while it insert here to the superior tubercle of the superior facet of the greater tubercle, and infraspinatus arises from the medial two-third of the infraspinous fossa, and here it insert to the middle facet of the greater tubercle. This is the middle facet, and you can see over here, this is the teres minor muscle. It arises from the middle two-third of the lateral border of the scapula, and here it insert to the inferior facet of the greater tubercle. This is the inferior facet of the greater tubercle. Now there is another muscle which is the subscapularis. You can see over here, this is called subscapularis. It arises from the subscapular fossa, and here it insert to the lesser tubercle. So I am going to remove the humerus bone. Now I remove the humerus bone from the rotator cuff, and you can see here a cup is appear here which is formed by the muscle and tendon of these muscles. You can see this is the cup which is formed by these muscles. So now what are the functions of this rotator cuff? It performs the two functions. One is stability, the other is providing extensive range of motion. First thing is the stability. You can see over here it hold the head of the humerus to the glenoid cavity and providing stability to the glenohumeral joint. The other is providing extensive range of motion. So going to the function of each muscle separately. So I have discussed the insertion and origin of the rotator cuff muscle. Now I am going to discuss the function of each muscle. So you can see over here You can see over here, this is the supraspinatus muscle, and the action of the supraspinatus muscle is abduction of the arm. So you can see over here, the function of the supraspinatus muscle is the abduction. You can see over here, this performing abduction is the glenohumeral joint. Now another muscle is the infraspinatus muscle. You can see over here, this is the infraspinatus muscle, and the action of the infraspinatus muscle is the external rotation of the glenohumeral joint. The rotation of the arm and forearm at glenohumeral joint. You can see the function of the infraspinatus muscle. So you can see the function of the infraspinatus muscle. It externally rotate the glenohumeral joint. Now the another muscle is the subscapularis. So the another muscle is the subscapularis. You can see over here, it insert here to the laser tubercle of the humerus. So it internally rotate the glenohumeral joint. You can see here. So you can see it internally rotate the glenohumeral joint. When it contract, it will internally rotate the glenohumeral joint. Now another muscle is the teres minor. So the fourth one muscle in the rotator cuff is the teres minor muscle. You can see over here, this is the teres minor muscle, and I have already discussed that it originates from the lateral border of the scapula, and here it inserts to the inferior facet of the greater tubercle. So this teres minor muscle externally rotate the glenohumeral joint. You can see it externally rotate the glenohumeral joint. Now we have discussed the four muscle, their action, their origin, their insertion. So this was all about on the rotator cuff. For more videos, subscribe, like and share. In the next video I will talk about on the shoulder joint. So thanks for watching the video.